Well, when someone has served our country and then leaves the military, they have access to health care and other services through the Department of Veterans Affairs.
But according to Tyler Hadyniak, an attorney who works with veterans, too many are not taking advantage of those benefits, or they don't quite understand them. I spoke with Hadyniak about one specific underutilized service, what he calls a secondary service connection.
It's where a veteran already has a medical condition that VA conceives is due to their active duty service, but then that medical condition has caused another medical condition later in life. So the very common example here is a veteran is service connected for their right knee pain. Maybe it was overextended in service or they injured it somehow, and they've gone along for years or decades hobbling on their right knee, but then compensating with their left knee. Well, under a secondary service connection theory, a veteran can try to get that left knee service connected.
That link, Tyler Hadyniak says, can be used for multiple conditions connecting to things like obesity, even social isolation.
That consistent knee pain causes a veteran to be inactive for their post-service life. That inactivity could cause obesity. But then that obesity causes hypertension. So in this example, the hypertension could be secondarily service connected to knee pain. Veteran with hearing loss is more likely to develop dementia than one who does not have hearing loss. I mean, you could really brainstorm a lot of examples. If a veteran has a psychiatric disorder like PTSD, maybe one of their primary symptoms is social withdrawal, social isolation. Well, there's medical literature out there that links social withdrawal over the course of many years to dementia onset.
Let me ask you this. How difficult is it to connect all of this? And is that sort of where you come in to help the veterans?
So VA disability law is surprisingly pro-claimant. So the burden of proof here, to prove that one medical condition is causing another, for example, is that the causation is at least as likely as not. It's not a cakewalk by any means. It takes the medical opinion of a doctor or other medical professional and knowing how to use the law. The worst VA could say is no.